Vishal, like I said, is the Group CEO of Fortis Healthcare, holds a Bachelor's in Science and an MBA from Bombay University, and completed an advanced program in hospital management from Boston. With over 20 years of experience in the healthcare industry, his current role is as the Group CEO of Fortis Healthcare, which manages integrated healthcare delivery across 8 countries in Asia, spanning 600 primary care centers, 240 diagnostic centers, and 65 hospitals, managing over 18,000 people in all. His key area of expertise is in successfully bringing various elements of healthcare together, or in our language, integration of all the various healthcare aspects and elements like strategy, operations, day-to-day management, people, and he does this through successfully using IT to integrate all of this. Under his leadership, Fortis has set multiple benchmarks in the healthcare industry. On that note, Vishal, it's great to have you here. We look forward to hearing from you. Vishal is going to talk to us about India's healthcare getting it right.
Very good morning, everybody, and it's a pleasure to be here. Thank you for this invite, Raj. First of all, I was just told that I probably have too many slides and I need to narrow it down, so I know project management starts here and right now. This morning, I want to fundamentally sensitize you around one area, which is healthcare. I know that many of us who come from different sectors, and I know the composition of the team over here has 50% of you who come from the IT sector, and many of you come from other sectors, but I think life sciences and healthcare is probably not the favorite subject for project management. And the reason why I'm here is because I want to sensitize you to the fact that probably the biggest project that we can get right in this country is probably to get healthcare right. And if we can get it right, I'm sure the success that we will see for the generations to come will quantify itself in the kind of healthier nation that we build up. So privatization of healthcare and fundamentally the growth around private healthcare has driven healthcare delivery system in this country, and not just here, but in many parts of Asia as we continue to expand and grow in the Asian subcontinent, we see the same challenges everywhere. So I also want to, before I start, I want to fundamentally compliment the leaders of project management. In the last 2.5 years, we have entered about 6 different countries and very complex assets in healthcare delivery. And the reason why we believe that we have been successful in integrating most of them is fundamentally because I had a brilliant team that was doing my post-merger integration, led by a person who is very passionate about project management. So across different countries, whether it's Hong Kong, Singapore, Vietnam, Sri Lanka, in the Middle East, out of Dubai, we entered multiple different countries and succeeded in integrating these assets in a very, very short period of time, almost close to $1 billion spent across these various countries, and helping to assimilate the similar thought process that we believe could create efficient healthcare delivery. So from that context, I fundamentally believe that healthcare is very well poised to receive many of you and to welcome many of you into our realm to make healthcare a more efficient system and a more efficient enterprise to deal with. Fundamentally, every nation around the world, and India being no exception to this, fundamentally faces the same challenge. And the challenge comes from advancing new technologies through an efficient healthcare system at affordable cost. One of the biggest noises that we hear around healthcare around the world is that it is unaffordable. The United States of America spends 16% of its GDP on healthcare, and it is still unaffordable. India spends less than 5% of its GDP on healthcare, and we are still unaffordable. So fundamentally, whether we are in the developed world or the developing world, our challenges continue to remain the same, and that is around creating a more efficient healthcare delivery system. And that's where I believe that the role that project management can play in terms of improving and enhancing the entire delivery process can create a big difference in efficient delivery of healthcare. The determinants of health, and again, from the perspective of the lens that all of us are here with today from an opportunity of project management and creating efficiency, what really determines good health for people is buried around these four fundamental areas. The area of access to care, and we have always been thinking that the more infrastructure that you create, the more efficient healthcare becomes. In fact, sometimes the opposite is probably true. We create infrastructure thinking that people will come through those corridors, but until and unless you create efficiency around it, infrastructure has no meaning. Genetics, all of us are born with a DNA code, and our code determines whether we will have certain diseases or no. So our opportunity of receiving healthcare or not receiving healthcare is also largely dependent on the genetic code that we come from. That's why some people live much more healthier than the others. Environment, which is beginning to play a big role. And in fact, the entire issue of climate change is one of the biggest causes of poor healthcare around the world. And we have not even begun to talk about it. But last but not the least, changing consumer health behavior is going to be 50% of the determinant of receiving good healthcare. And changing consumer health behavior in this country is probably one of the biggest projects that we have in front of us. Because if we are able to change, and if we are able to change the entire aspect of consumer behavior in this country by efficiently looking at the delivery of healthcare, we would probably have done a lot more good. So changing consumer behavior, to my mind, is one of the biggest projects in healthcare that we can actually undertake around this country. The global health issues, which are fundamentally creating an impact on healthcare, the number one, which is aging world, and I'll take you through some very glaring figures in terms of we all believe that we in India are living in a very young world. The opposite is beginning to stare at us, and we have not even begun to think. We are probably an aging society which is aging much, much faster than what we believe. And there are some numbers out there. By 2050, 323 million people in this country will be over the age of 65. And that is equivalent to many countries combined together. Their healthcare needs will be of a very, very different magnitude and order, and also in terms of the kind of money and expenses that will go behind creating the opportunity for that segment of the population to receive better healthcare is going to be a very large project in itself. So diversity of the races, diversity of cultures is also responsible in terms of the kind of global health issues. There are certain sections and there are certain communities around the world which are more prone to diseases. And we, in fact, in this country, are poised to receive some very chronic care, fundamentally because of the fact that 43% of our population at some given point in time is going to be suffering from some level of chronic disease. We have 43 million diabetic patients in this country today, which is the root cause of multiple different diseases that are going to happen. So by no circumstances are we in a position to lie back and say that we are probably going to get better and better healthcare as our GDP continues to expand. Not happening. Epidemiology is changing. Disparity and cost, one of the biggest issues around the world, as we just talked about it. And last but not the least, and I'm sure as I was hearing you, that many of you are already using a lot of stuff which is the click and stream. And one of the biggest changes that is happening around the world in healthcare is around the entire impact that the internet is making in terms of consumer choices. So many of you who come from the IT world, we are probably in the healthcare world getting much more impacted by IT today than we have ever been. And again, how we change the determinants of healthcare using technology is going to be one of the biggest differentiators for our own country. Not to go through each one of them, but I think we need to look at it from different lenses. We are finally realizing that healthcare being social good is important, but equally important is healthcare being economic good. Economic good from the perspective of making it more and more viable, that's one. But secondly, economic good also from the perspective of creating a healthier population, which will translate itself and which will probably give us a better and more economically healthy environment and a country. So more number of productive people probably lead to more productive nations. And that's exactly why health as an economic good needs to be understood and needs to be imbibed. Again, from that context, many things to be done in order to make healthcare more and more viable, particularly from the fact that 60% of healthcare delivery in this country actually sits on the private side. And I have some data points with you, which just goes to show that while we want the social good of healthcare, it being driven through the private enterprise, which has to look at economic viability, it needs that much more skills and that much more enterprise to sort of make it more efficient. The interaction, we just talked about chronic diseases. The third one, patients are now looking at partnerships. So we are no more in a situation which is a top-down approach. There are many, many of us out there who sit in front of doctors today and ask many more questions than what our previous generation ever did. Because we are far more knowledgeable, the environment around us is far more knowledgeable, and we are fundamentally probably taking many, many more decisions around our healthcare today than what we ever did. And again, from that context becomes that much more important that we as professionals reach out there and create environments which are that much more efficient from our perspective. Our contact with them will be lifelong. So consumerism is finally hitting the frontiers of healthcare. And if consumerism is going to be one of the key components of change in healthcare, a lot of us have a lot of things to do. Because many things that we do in our own world, and probably what all of you do in your own world, is built around creating products and services and making them more and more efficient in the environments and the technologies that you use. And we believe in healthcare that one of the biggest changes that we are going to see is the drive of consumerism to create more lifelong relationships. So that's something that is going to be a lot more important for us. Knowledge management in terms of building of protocols and processes. This is an industry, this is a sector which has probably not seen that much impact of processes as many others. We believe, and many of us who manage healthcare enterprises on a professional basis, we believe that there is a lot more process-driven approach that we need to create in this sector. And if we are able to do that, and one of the biggest investments that we as a company are doing, and that many of my colleagues in the healthcare sector are doing today, is around creating better processes. And if we have to create better processes, I see a lot more influence of project management in our own environments. And last but not the least, I think clinicians who have and continue to be one of the core pillars of strength around healthcare delivery, their entire interaction points are beginning to change a lot more. And for the first time, because again of the drive of consumerism and the drive of privatization in healthcare, we are seeing a very, very different environment around how clinicians approach the delivery of healthcare, and some great opportunities out there. So just to wake you up a little bit more, so we are actually talking about healthcare consumerism. So customers, everybody has been talking about healthcare from a very patient lens, but we are beginning to see them more as healthcare consumers. So what are going to be the big change drivers, and why should you and I be looking at it from a project management lens? What is really going to happen out there which is going to make a lot of difference, and why I believe, standing over here, that many of you can contribute a lot more in healthcare. Consumers today look at a solution. The future is going to be about keeping me well. So one of the biggest things that we would require to do in the future is about preventative health and creating wellness more and more than what we do today. So we are probably going to be looking at societies from a perspective and from the lens of how we can create longevity of life. And if longevity of life is going to be our key determinant, then how do we go out there and create better solutions? Societies, healthcare is a societal right. That's how we have seen it. That's how it is in various parts of the world, and that's how it should be. But more so often, it is going to be limited by funding in the future. We've all seen in the recent past and in the recent years that the flow of capital across industries and across sectors is getting more and more limited. So with a limited supply of capital, how are we going to create more efficiency is going to be a big area for us, particularly in healthcare, which has been pretty inefficient in its approach because of the lack of management principles. Thirdly, in terms of payers, our entire approach, and as we said, that if the approach is affordability, then our current approach is how do we just keep on continuing to minimize cost. The flow in the future is also going to be about value creation, cost effectiveness, productivity improvement, and that is going to be determined a lot more by how much more management principles and project management principles we're able to imbibe in terms of creating more efficiency. Providers are today focusing on more and more on curative activities, but in the future, it's wellness and prevention. Because you create a more well society, you probably create a lesser sicker society. And that's what we all want to do a lot more in the future. So this has been traditionally, on the left-hand side is the graph, which traditionally is the traditional way, the way that we all see healthcare. Primary, secondary, tertiary, you go into your doctor's clinic and get yourself treated for cough, cold, and fever. That's primary healthcare. You get into the most tertiary care hospital in terms of a heart surgery, a joint replacement, a neurosurgical procedure for the spine. Those are at the top end of what we call as the tertiary healthcare segment. But on the right-hand side, the information age has created multiple new stakeholders. And if these stakeholders, with each of these stakeholders revolves a totally new world and a different approach to looking at things. So whether it's professionals which we believe today are at the top end of the pyramid, if that is going to be at the bottom end of this pyramid, and many other influencers are going to come in place, we are going to see a very, very different world of healthcare. And that, from our perspective, becomes that much more challenging and enterprising to go out there and chase and make more efficient. I was talking to you about in terms of what's going to really change. Across the world, 6% of the people with chronic diseases contribute 33% of the dollars spent on healthcare. 6% of the people, and if you look at the bottom end of the pyramid, 72% of the people who do not have chronic conditions take away just 36% of the dollars spent on healthcare globally. We in this country need to be pretty worried about these statistics because our genetic pool, our issues, our environment, and our healthcare needs are going to get so intense over a period of time that if we do not really watch out, we are going to be creating a lot of issues for ourselves as a country around healthcare. And that's why it is extremely important for us to create the enterprise and the management skills and an approach to create efficiency which is not going to let us go down this path. And that's where I believe that many of us can contribute a lot more. We talked about this, starting with the environment and then the environmental needs of healthcare, which are absolutely basic, to the top end, which is about optimizing healthcare. So if you see this triangle, across every segment of healthcare need, there is project management required today. Across the environmental needs in terms of ensuring that the basics are in place. And so ultimately, what do NGOs deliver to us? Ultimately, when we say that one of the biggest impacts that the NGOs make is to create the basics of healthcare. And every NGO fundamentally operates with a very project management lens. They have timelines, they have funds, they have limited opportunities, and they try and efficiently monetize that. And right at the top, when you look at the optimal part of healthcare, which is to enhance wellness, that's a project in itself too, because that reaches and transcends the entire country. So I look at this pillar and I look at every segment of this triangle as a project in itself for everybody sitting in this room and for those who are outside in the world of healthcare. And many new opportunities which are going to stare at us in terms of how we can do it. So this is probably one of the most revered slides that I often put up. 21st century healthcare delivered with 19th century management principles is actually the truth of healthcare. Because we have been probably the last sector around the world which has imbibed good management practices. And now that we are, that is the reason why I believe For many, many professionals like yourselves over here, there is a great opportunity to enter healthcare and make a difference. Not from the perspective of that these are just going to be one-off assignments, but we believe in all across our enterprises, everything that we are doing today is becoming very project management focused. Whether we are trying to create efficiency in our outpatient departments, whether we are creating efficiency in our operating rooms, whether we are creating efficiency of the way that our infrastructure is planned, whether we are creating efficiency in terms of the way that we build and launch our institutions. Healthcare fundamentally and across the world has had huge lag times and gestation periods. From the time that you conceptualize a project to the time that you actually launch it, the average delay time in a healthcare enterprise is about 6.5 to 8 months. 8 months of capital lost, fundamentally because of efficiency not created in the way that we've looked at it, is one of the biggest issues that we have and we face in healthcare. And that's where a lot more management skills and project management skills come in. So just to give you some more data points, 2010 was the first year when the old were higher than the young on planet Earth. And we fundamentally do not believe that the world is going to stare back at us with an aging phenomena. Average life expectancy in Asia is expected to rise to 75 years. In our own country, the average life expectancy currently is about 68 years. And just about a couple of decades back, we were talking about an average life expectancy of about 44, 45 years. We've added 20 years to our lives in the last couple of decades. And that's phenomenal for a country that is growing so phenomenally well. But fundamentally, from a healthcare perspective, a lot more challenges out there. So India, rising GDP, we all know, even if the current circumstances what are facing us, we will continue to be a high-growth country. No matter what stares at us, our basic fundamentals are all there for us to grow well. The services sector, and all of you who come from IT would have probably seen this a lot more. 2025, services are going to be 65% of our growth trajectory. Healthcare services is going to be a key component of all this. So while we all believe IT, ITES, and many other services, hospitality, airlines, but healthcare is one of the most dominant drivers that we are going to see on the services side. And that's why all of us are so energetic about the way that we see private healthcare delivery. Of course, the problems continue to be the same, whether it's infrastructure, education, and unaffordable healthcare. But the confluence of persistent basic health problems and the onset of rich world diseases is creating unprecedented challenges for us. And that's why we believe that we need a lot more management in healthcare. And that's why we believe that because this confluence is going to be extremely challenging to deal with, we want more and more in the healthcare world to come from the professional world of other sectors and other enterprises. India spends close to about $45 billion annually on healthcare delivery. 80% of the healthcare delivery takes place in the private sector. And we all fundamentally believe that, that why are we constantly talking about private healthcare delivery systems and more expensive and unaffordable? It's fundamentally because the entire push of healthcare delivery in this country, it comes from the private sector. While we know that on the public side, we need to create a lot more efficiency than where we are, our per capita healthcare expenditure on a CAGR basis is growing at about 10.3%, but we still on a per capita basis spend just about $89, which is nothing. Compared to what many other countries have as a spending power in terms of healthcare. Only 6% of our healthcare delivery is in the organized format. So consider this, you're a country of 1.2 billion people. 6% of healthcare delivery comes from the organized sector. And imagine the kind of opportunity that we have sitting in front of us to organize this sector. And imagine the kind of opportunities that we have from a project management lens to create efficiency in this sector. And that's one of the biggest opportunities that I see. So again, in terms of statistics, while we look at all this, most of our beds, and that's the dichotomy of the situation, we have 60% of our beds sitting on the public side, but we have 80% of our expenditure happening on the private side. Absolutely dichotomy. So somewhere down the line, the efficiency push that you see on the private side is coming from here. That we have a lot more private healthcare spend. Capacity is sitting on the other side, and more capacity is probably going to get generated on the private side. And that's the future in terms of the way that we look at it. 80% of our clinicians actually sit on the private side. So 60% of the beds on the public side, but 80% of the clinicians on the private side. This is a sector which has to evolve. This is a sector which is staring to evolve. This is a sector which the forces of change are going to ensure that we make it much more efficient than what it is. We have about 1:1,500 hospital beds per people in this country. The WHO recommendation is 1:300. We will need about 80,000 new beds to be added every year for the next 5 years to be anywhere close to the WHO data. So that's the kind of phenomenal growth that this sector is going to go through, because as the propensity to receive better healthcare changes, we are going to see a lot more of infrastructure build-out going to happen. So for those of us who continue to be buoyant on healthcare, it's fundamentally because the demand-supply equation over here is so skewed today that we are going to see a lot more efficiency to be built out in this sector. GDP spend on healthcare, we just went on it. I just wanted to show you that how many other countries around the world are actually spending far more in terms of their GDP than what we are. So we often talk about the BRIC countries, the breakout nations, and things like that. In the current world, none of that is really applicable. But if you just go and see it, this is the kind of disparity of spend that happens across the world. So if we have to reach anywhere midpoint, healthcare will have to deliver a lot more. Growing and aging population, 2026, we're going to see 41% growth on the top end of the segment, which is about 60 years and above. So fundamentally, 170 million people above the age of 60 by 2026, challenges in itself. India will see 323 million people more than 65 years, huge challenges in front of us in terms of what we need to do. We just spoke about this in terms of hospital per bed ratios. Another one, skills, and why we believe that more and more skills need to come into this. If you see both on the clinical and the paraclinical side, India is one of the most underserved nations around the world in terms of the creation of skill sets, and why it is important for us to enhance the entire skill set. So you're going to see a lot more invested on the med-ed side, which is on the education side. You're going to see a lot more which is going to happen on the education side from the perspective of management skills. You're going to see a lot more which is going to happen in terms of the nursing talent that we require in the country. And more, we are going to see a lot more managerial talent build out in this sector. So we believe basically that while everybody looks at this sector from a lens of clinicians and nurses and paramedical staff, a lot more needs to happen in this sector from the skill sets which are required on the managerial side. And that's what creates another big opportunity for us. If you look at it across the world, and if you look at from a global average perspective, we are far below the global average, both on the clinical side and on the paraclinical side. So big opportunity that we see in this sector in terms of trying to just get the right skill set and the right skill pool to be generated and to be enhanced within the sector. We talked about this, so I won't go through this. Rapid urbanization. In the next 2 decades, or the way that we see it now from the perspective of 2027, the rural and the urban divide, which we have often seen, bridges itself very quickly. The million-plus towns are going to reach about 75 by 2027. Many of our smaller cities are equivalent to populations of many other countries around the world. So one of the big opportunities that we see as healthcare providers is the Tier 2 push in the country in terms of reaching out to the Tier 2 and Tier 3 cities, because we believe healthcare is going to evolve far more quickly in many of these cities than what we have been able to do on the urban side. If it took us 3 decades to get the urban healthcare right, it will probably take us just about a decade to get the tier 2 right. And that's where we see, again, as one of the biggest opportunities in terms of rollout, in terms of project management, in terms of efficiency creation, and in terms of creation of new infrastructure and new skills as far as the tier 2 cities are concerned. Just some quick snapshots in terms of data points. And I know many of you would have probably seen it. So this is how India is urbanizing itself so quickly. And we believe in healthcare. This urbanization is going to land itself in terms of creation of better healthcare opportunities for all those people who are sitting in that part of the world, which in our world is going to get urbanized very quickly. So 52% of India's GDP is 60% of consumption expenditure. So if you see, healthcare is going to be one of those categories. So just take a look at this. 5 categories which will be accounting for more than 80% of cumulative consumption over the next 20 years. Healthcare sits at number 4. So no matter which way we look at it, no matter which way we skin this onion, healthcare in this country is going to be and will continue to be one of the fastest growing sectors. The sector currently is growing at about 20% on a CAGR basis, and we believe that the next decade, the CAGR is only going to be moving faster. So from this perspective and the perspective that we continue to grow between, say, 7 to 8% of our GDP, the growth of this sector is going to be probably amongst the fastest in the country. Healthcare consumption growth, both on the rural and the urban side, and again, why am I showing this data point to all of you here, is because the opportunities around creating the right project management skills on the urbanization of India is going to be probably equally important, because a lot more is going to happen over there. So if you take a look at between 2005 and 25, 8.4% and 6.8%. So we are almost going to grow literally equally on both the sides. So we have seen cities evolve themselves so quickly with the right governance mechanisms put around there, and we believe that from a healthcare delivery perspective, there's a lot more opportunity out there to create the right efficiency. India is going to become the 5th largest consumer market in the world by 2025. These are just some comparative data in terms of, and because any issues or anything that is going to happen on the consumer side is only going to enhance healthcare consumption. And it's a growing fact. If you look at the history of the world and look at countries which moved from developing economies to developed economies, and if you plot their last decade or the last 2 decades, country after country has proven it that healthcare grows the fastest. It is just a question of infrastructure building out, and it's a question of affordability. And the moment people are able to afford better, their private or their healthcare consumption just increases. So we are probably sitting at the cusp of that change right now in terms of what we see and believe will happen to healthcare. Great opportunity in terms of being a part of a sector which is probably going to be contributing tremendously to GDP growth in the future. But on this flip side, poor healthcare can severely also impact economic growth. And that's why all of us are today thinking a lot more differently around healthcare delivery than what we did 3 decades back. This is one of those changes. So again, just some question points over here. Why do people go to doctors and why do people go to hospitals? And if you see your own, and in your own surroundings, your own families, your own kith and kin, today when there is a medical emergency in your surrounding, you just go to the nearest hospital. So emergencies are driving that, and then you start thinking about, what do I do next? Or secondly, have I gone to the right clinician? So an enterprise and an activity or a sector which was largely dependent on the skill sets of certain individuals, being the core drivers of growth, all of a sudden finds itself in a realm of institutionalization. So the shift from clinical-led to institutional-led healthcare is one of the fundamental shifts that is happening in healthcare. And a lot of that is helping grow the professionalism of the sector. And we believe that, and as I said, that one of the biggest changes that we believe is happening on the private side is fundamentally the opportunity to create and to work with project management, with PMI teams, and with PMO teams to help make many of these clusters get more and more efficient so that when consumers look at us, they look at us very, very differently. Of course, these are some big changes that are taking place. We talked about it. I won't go through it again. What's also really happening is the push from inpatient care to more and more ambulatory care. So one of the big shifts that we are seeing in healthcare, and which you will see more and more as new formats and enterprises come up, and again, why is that happening? It's happening because we're looking at efficiency of a very different order. We want patients to remain in our hospitals lesser and lesser. We want to throw out a lot more work in outpatient settings. And when I say throw out, because it just creates more efficiency for the consumer, for the enterprise. And a lot of these changes today in our own environments are being driven by our project management teams. In fact, the entire change and push that we are seeing as to why certain activities should be done on an outpatient basis was a program that started out of our project management teams, because they believed that we could unlock a lot more efficiency and create a shorter average length of stay, and therefore create more and more on an outpatient work. And that is what is giving rise to a very different healthcare environment. And many of these things in our own environment have been done by our project managers in terms of putting it all together and saying that when you look at a hospital in the center, what else do you look at? And this is, in fact, this is a chart which was a lot contributed by the project management teams within our enterprise. So we're looking at daycare centers, we're looking at ambulatory surgical centers, we're looking at retail healthcare in terms of just making the push go out, we're looking at rehabilitation centers as standalone enterprises, and we're looking at boutique healthcare delivery models. So everything that we're looking at is built around the fact as to how you can unlock more efficiency. And there are teams which are working behind each one of these models for us so that we can create more efficiency. And it is being led by our project managers. We won't go through all this. I think I just want to conclude in the next couple of slides. We've always looked at, and I'm sure that you as project managers would probably relate to this a lot more. When you look at things from a cost lens, you look at value depletion very, very quickly. When you look at value enhancement, probably you don't really look at cost as the primary element, but that value enhancement probably makes affordability and costs go down. And that has been a typical project management approach. And that's exactly what we see in healthcare today. We see that the problem with driving costs down is that value often goes with it. And we want actually the other things to happen. We want fundamentally value enhancement to happen in healthcare by creating more efficiency, by creating more professionalism, by creating more utilization of productivity measures, and by having more in terms of capital efficiency take place. And we believe all that is going to add a lot more value in terms of our patient care processes. Because if we are able to define that, we are going to be able to define much better quality of care to our consumers. And that's what is very important for us. One of the other things, and as I said, that the internet boom is creating multiple new options. And that is what consumers are today bombarded with. So the net has become, I'm sure when Deep talked to you yesterday, Make My Trip is Make My Trip fundamentally because he used the power of the net so efficiently. And we believe that one of the biggest change drivers in healthcare is the power of the internet, in terms of consumerism and also in terms of creation of alternatives and more efficiency within the system. So the convergence, and again from a technology perspective, one of the biggest changes that we are seeing in healthcare is the application of technology. We fundamentally believe that technology is not just hardware that we put in terms of new equipments and new state-of-the-art technology. But one of the biggest drivers of our change is the technology at the back end. One of the biggest drivers in efficiency that we see is the impact of technology in terms of creating more efficiency, whether it is by admitting people in a shorter period of time or discharging them in a more efficient process. So the confluence of technology, of innovation, of consumerism is the one which is really driving healthcare very, very hard today. And And under each one of these buckets, there are enough and more of project management enterprises or project management opportunities which are helping us to deliver better healthcare. So this is a synopsis as to why we believe and why I fundamentally believe very, very strongly that good project management skills and good project management can actually change the world of healthcare. Because if you see all the needs of this sector today, and we have actually delivered on many of them using our project management managers within the entire team. The patient as a source of control. And I know that many of you, when you look at your projects, you start with what is the nidus? And how do you build processes around that nidus to create more efficiency? We are putting the nidus as the patient in the center of control, of building the environment around the patient and around their families. And around them then begin to hold a lot of whether clinical efficiency or administrative processes. Shared knowledge and the free flow of information. One of the biggest issues in healthcare delivery in the past has been the transparency lack of information. As healthcare consumers, we often believe that we don't have enough knowledge of what is happening around us. And so we often are dealing with this transparency issue. One of the biggest changes of healthcare is going to be around creating more transparency of information, whether amongst clinicians, whether between enterprises and consumers, whether between consumers themselves. We are seeing a huge consumer movement happen in this space, and by just putting together the information flow. Evidence-based decision making, and that's where a lot of the technology comes in. Safety as a system priority, because ultimately safe systems are more efficient systems. And of course, healthcare is an area where you cannot be unsafe. By its very nature, you need to be safe, and that's what creates more efficiency. The continuous decrease in waste management, which again, from your context, is something that you constantly look at in terms of how do you create better efficient processes and reduce waste, and cooperation amongst our key stakeholders. So I fundamentally believe that from a healthcare lens, that if that is standing out here, and for many of you who I would want to probably go down the healthcare route, that if you don't like change, you're probably going to like irrelevance even more, and this is something that we keep on continuously emphasizing to our own organization, that the lens of change has to not only be imbibed, it has to be lived. And healthcare is probably one of those sectors which will encompass change management the highest amongst all the sectors around us because of the sheer demand-supply gap that exists in this sector. So the way that we see it, I do believe that the next couple of decades belongs to healthcare and belongs to the way that we will create this sector and evolve this sector. And of course, 21st century healthcare needs to be driven through all of you with 21st century management skills. Thank you very much again, Raj. It's a pleasure to be here.
Thank you, Vishal. There are a few things that you said that were fantastic. As project managers, we deal with change every day, and we come with a healthy dose of irrelevance anyway. So we are going to survive the healthcare boom. Are you all excited to join the healthcare industry? Because I am. Wherever we get jobs, we go there. A couple of points that you said about we are aging faster than we all think. Yeah, we know the phenomena. That's what we do with our project schedules. The dates come faster than we think. Project management to drive better processes, I think we can help you there. And about changing the model from focusing on the patient to focusing on good health, I think that was the key message. Thank you very much. I now invite Sonali, the president of the West Bengal chapter, to hand over a memento to Vishal.